Hello, it's Joanna Lumley here. And before we start this podcast, I wanted to take a moment to tell you about the Actors Benevolent Fund, which is here to support actors and stage managers in times of illness, injury, old age, and financial hardship. This industry can be wonderful, but it can also be challenging. And the ABF is here to help by offering grants in times of need and by providing a sense of community. If you're in the position to help support others in our industry, or if you need support yourself, you can find details of how to contact the ABF, as well as ways of keeping up to date with developments via social media, in the show notes of this episode. Meanwhile, why not become a member, which you can do through the ABF website. Thank you so much.
Hello and welcome to the ABF podcast, where each week we invite special guests to talk to us about challenges they faced in the theatre and TV industry, from dealing with performance anxiety to rejection to coping with ageing and questions around our identity. Sat alongside them each week, we have coaches and therapists to help unpack the subject and offer practical advice. My name is Hannah Whittingham and I will be your host. As a bit of a bonus episode, we wanted to focus in on therapy itself and offer a bit of advice on how to find a therapist, what to expect, and importantly, how to have the conversation if and when you want to leave. For this, I'm joined by Mary Burch. Mary is predominantly a person-centered therapist and a supervisor of other therapists. She's also head of counselling for Industry Minds, an award-winning, industry-leading mental health charity for the creative arts. So I thought it would be really useful to end this series just by having a little episode that's just dedicated to therapy for people who are thinking about dipping a toe in and committing to therapy in any way. And I wanted to speak to somebody very knowledgeable about this, as you are. To start off, I suppose, with just asking, where do people start? If they're thinking of engaging in therapy, what's the first step toward doing that?
And I think, I mean, that's a great question, isn't it, Hannah? How do you find the therapist that's right for you? And lots of ways of doing it. There is that, obviously, that formal route. You look at the therapist directory. You look at, one of the professional associations, be that BACP, NCPS, UKCP, whatever. And they all have lists of qualified therapists, and their credentials are there. The fact that they belong to a professional association initially. So that can bring a bit of comfort to people. They know they're getting someone experienced.
I was going to say, so is everyone on one of those lists have had their credentials right?
Oh, right. Everyone on the list will have had their credentials checked.
Yes,
but but not everyone has to be on one of those lists.
Sure.
Not everyone joins a professional association. And so it's a personal preference, and that doesn't mean they're not good therapists.
Sure.
Because they choose not to be, a member of a professional association. But it brings that level of comfort for some clients. And I think, therefore, it comes down to the relationship. That's what makes it work. Whether you can trust your therapist, whether you can, have that rapport with them, that you're able to open up and know that you won't be judged, know that they will absolutely see through your eyes what's happening. So, and funny enough, just this week, been having chats with some clients. I get most of my clients through recommendation.
Sure.
And I think that is a good way to do it. That if you know someone who's in therapy, and you go, well, who do you see, Hannah? Would you recommend them? And that way, there's already a trust. If Hannah, if you were saying, oh, my therapist is such and such, you go, well, I trust Hannah. So, if she likes this person, there's a good chance I might as well. So that, asking around, asking your friends or whatever, you go, would you recommend someone?
Is there ever any sort of conflict when for instance, if you are very good friends with somebody who has a therapist they really like, is it ever an issue, do you think, that a therapist would have two very good friends who potentially may be talking about each other in their sessions?
There's nothing ethically wrong with that, Hannah. And again, that will be a personal choice for the therapist. I find myself working with clients, and then someone else will come, a new client will come along, and some weeks later or months down the line, I go, and of course you work with my housemate, or even you've worked with my partner. But it's not, because there's not that connection there. That and although they might be talking about each other as that, there's an issue that therapists can compartmentalize. Therapists can just, it's that blank canvas. Yes, that when you meet someone, if it's very close, a husband and wife or whatever, and they're talking about the same problem, perhaps marital problems, you can see then there's a potential conflict, because you're hearing one thing, and no matter how good you are at compartmentalizing, that might be quite difficult to put aside. Yes. But friends, housemates, whatever, they're bringing their own issues. There might be little bits of, if the issue is, this is what my housemate does, and that's what they're bringing, yeah, I would rethink that and go, maybe refer you on to someone else, so that you don't get caught up in that. But generally, they're bringing different issues. There is that as well in picking a therapist. It's about their experience more than anything. So if, someone who's perhaps coming with trauma, it's not every therapist who can work with trauma. So the therapist's experience is important as well. And I think in that first meeting, when the therapist and the client are maybe getting to know each other, it is asking those questions. Well, what's your experience? How many hours have you worked over your time as a therapist? And do you specialize in anything? Do you have experience with anxiety? Do you have experience with eating disorders? And checking that out, because it's about that right fit, isn't it? Finding someone that will meet your needs. So, and a good therapist won't be offended.
Yeah, I was actually just going to pick up on that, and you've said most of them already, but just in case there are any more, what would you suggest? If somebody had their first meeting with a prospective therapist, are there sort of a certain number of questions that you would go armed with to sort of suss out whether this might be somebody who is a good match for you?
Well, yes. I mean, if you think if you were putting a kitchen into your house, Hannah, you would want to know the joiner's experience. How many kitchens have they fitted? What's your feedback as such, your rating? You would want to know, how good they are, because you're going to spend a lot of money putting in a kitchen. And it's the same, with a therapist. You're going to open up. You're going to be very vulnerable with a therapist. You're going to perhaps share things that you've never shared with someone else. So you would want to know that they're going to be able to hold that safely for you, that they're going to understand as such. They're going to be able to see it through your eyes, have that empathy, and not bring their own judgment into it. So really any question, anything that's there that might be, well, how long have you been doing this? What's your background? What's your training? What kind of clients have you worked with? Do you have experience in this? This is what, I'm struggling with depression. Have you worked with depression in the past? Nothing is off the list. Whatever brings comfort to that client, so they can start to make a judgment and going, can I work with you? And that's the bottom line. And no therapist or no good therapist would ever be offended by those questions. Indeed.
That's great.
So, yeah.
Yeah. And I guess the other question is just the different types of therapists that are available out there. I think it can be quite baffling to someone to look through, BAPAM's pages and see all these different
Yeah.
categories and types. How much do you think people need to know about that, and how to decide which type of therapy is going to be the one for them?
And sometimes they don't. Sometimes they may have an
Mm.
idea where they just go, I just want to talk. I just want someone to listen to me. And obviously the talking therapies that are there, the person-centered, even CBT. But a therapist as well, in that first introduction, a therapist will give a little background of
Right.
the type of therapy that they can offer. I have clients, in fact, maybe they already come on, they'll go, actually, I want to do some CBT, Mary, and I like homework and I like to be challenged. So the therapist thinks, do I have that in my skill set to be able to offer to the client? But otherwise, the client, you don't want to sort of really make things too complicated. Go, let me explain psychodynamic therapy to you. Lie on my
Yeah.
sofa. Yeah. Lie on this couch and we'll talk about it. Let's talk about your father. The sort of saying psychodynamic, gestalt, transactional analysis will probably mean nothing to anyone.
Sure.
But you get an idea of what the client wants.
Yes.
And that might be, I want to be challenged. I really want to look at what's happened in my past that's impacting in my present. So, and then you go, right, we are talking psychodynamic there, CBT, if they want lots of homework and exercises, that. So, but a brief outline, Hannah. I know I'm blethering, but a little brief outline to go, this is what I can offer. Yeah. And does that seem to fit? And if the client, after a couple of sessions going, that's not for me, then you go, fantastic, you find the person who can deliver what you want, and that's what will make the change.
Yeah, that's great. And I mean, the only other thing I was thinking, just in terms of demystifying things slightly for people, is what the difference is between a counsellor and a therapist, which is, they come up as completely separate things often on lists.
They do, and again, another great question, and you would probably get about 6 different answers to that. What I remember, most people say there's not really much of a difference.
Sure.
I call myself a counsellor, and I am, if you look at it, I'm a psychotherapist. But the training I did at Strathclyde was counsellor training, and I go, it's a simple term that people understand. What does a psychotherapist mean? What does that mean? Does that make sense? So I stick with counsellor. Yeah. I suppose the difference is, in my view, that counselling tends to be almost short term.
Right.
And you're looking at the here and now. You're looking at the present. So someone may come and say, I've lost my job. I'm just worried about finances, the impact on family. There's a kind of one issue that we concentrate on in the here and now, how to help them through that. Psychotherapy tends to be a little bit longer, and that might be someone who comes with trauma and go, and these are things that happened to me in my childhood, and they're impacting in my here and now. So we're looking deeper. We're looking into the past rather than just the here and now, and does tend to take a wee bit longer. Some counselling sessions, I've had clients who have been there for maybe 1, maybe 2 sessions, and they're gone.
Right. Yeah.
Because we resolve whatever that issue is for them. Psychotherapy, we are working on childhood issues, or we're working on trauma. We're working on the impact of past experiences, and then how that is affecting someone in the present day.
I also think it's really useful for people to know that quite often people who are trained as psychotherapists or in other sort of similar sort of titles will often refer to themselves as a counsellor, because you're right. I think therapist still comes with a little bit of scary factor for some people, whereas counsellor seems much more approachable somehow. On which note, what should people expect from therapy? I think, it's getting better. I think the general awareness of what therapy is and what happens in the room is more widely known now, but I think there is still a bit of a fear over therapy, and there is still a bit of a question mark over what happens in that scary room. So maybe it might be useful for people just to have an idea of how it might be.
And I suppose what happens is in the room is very much what the client wants to happen in the room, to a certain extent. Very person-centred. The client brings what they want to bring, what they want to talk about, and that's the route we follow. It's funny enough, just this week, 2 new clients I had. One of them was absolutely shaking with fear coming into therapy, and the other had said to me that he was scared to come to therapy because he was terrified of what might be in there that he was unaware of, almost, and allowing that out. And both, sort of reassuring both that it goes at the client's pace. The client brings whichever they want to work on, and it goes at the pace that they're comfortable with. So someone who walks into a room, who may, again, I know I'm sticking with trauma, but it might go, I have a past trauma. I would never go, right, tell me about that trauma. Let's get in there. It's allowing them to build that trust, to allow themselves to be able to have a place and not even talk about the trauma, Hannah, but maybe talk about the emotions that come for that trauma. Some do want to talk about it, but whatever is right for the client, that's what will happen in the therapy room. Again, it depends on the modality of the therapist. So some will just want to go, I just want a space where I can talk. Others will want a little bit more direction.
Yes.
They want, as I say, they want to be challenged. And it's that finding, what does the client want? So bottom line, whatever the client wants to happen in that room. That's not to say a therapist may at some point start to challenge a little, so that, the therapist may see, I can maybe see where we're going here, but we're not quite reaching it. Yeah. But it will be very gentle, and it will not be intrusive. So it's such a safe environment. Absolutely. And there's no judgment. What can they expect? Someone who will just listen, who will not have no judgment, who will be able to see that experience through the eyes of the client and help them find whatever change they want to change in their own time.
Yeah.
Yeah.
Is that your dog in the background?
Would you believe that, Hannah? And that I don't know how to quieten her. I'm just going to go and shout at her. Okay. Would you believe it? I know. Dog's in the kitchen, fingers crossed, yes.
Lovely.
That she can't hear anything apart from the dog out the back. Hopefully doesn't start barking.
For the chorus of them.
It's this time of night, yeah.
I know. Whilst we're talking about what happens in the room, the next question, I guess, is your thoughts on in the room versus on Zoom, and how people, because I'm aware from having spoken to a few people that even though obviously we can go back in person now, quite a lot of people actually are preferring to stay on Zoom and to keep it as an online relationship. What's your experience been? Perhaps what have you seen from the people who see you in terms of people's preferences? And do you favour one or the other over the other, or do you think they both have their own benefits?
Yeah, but I think they both have their own benefit, and again, it's about the client as well. Pre-lockdown, I was only face to face, And I know when Scarlett from Industry Minds had said, what about going online using Zoom? And go, never work. No, that's awful. And then tried it, and you could see the benefit for the clients. They're not traveling long distances. They can do this in their lunch break. It just gives so much more flexibility. And I'm a big fan of online now, of using Zoom. I think they both can bring something, and some clients who prefer that face to face, absolutely. There's a bit of me, I can see the whole body, I can see all the body language.
Yes.
It's maybe harder work. You're listening, you've got the voice and the head and so on Zoom, but they both work. And recent studies, there have been several studies, Hannah, that's going, the benefits of online and face-to-face. And the results of all of those studies are saying they're equally good.
Wow.
There is nothing lost from delivering online sessions, which is interesting.
I, having experienced both myself as a therapy, I've found, I agree with both in that there is a certain richness that isn't there when you're on Zoom, but I think there are things I've talked about more easily as a result of not being in the room as well. Because I think there is a certain a little bit of the heat sometimes is taken out of it when you're in your own space. I've usually got one of my dogs on my lap. There's something that means that I'm sometimes a little bit more willing to talk about things that perhaps would be more difficult to do in the room.
And that's interesting. When I did my training, and I know it was a long time ago, and one of the things that came across was we didn't do therapy in someone else's home because that was their safe space.
Ooh.
And we didn't want to, and we didn't want to invade that safe space.
Right.
And then we had lockdown, and wow, how all of that has changed. And maybe discovering that actually that is where they feel safe sometimes for having therapy. Because you can have the dog on your lap. You've got your familiar things around you. And that safety actually allows you to open up, to be vulnerable. So quite a change. Yeah.
Do you think it is useful for people to change therapists every now and again? Do you think it's most useful for someone to really stick with someone? Is there an ideal amount of time after which you maybe look for someone else?
And again, it comes down to personal choice. But I think, that the therapist as well as the client can maybe find themselves getting stuck. And that things aren't moving forward, and yet there's still something there. And I would hope a therapist would be able to say, do you know, Hannah, have you thought about EMDR? Have you thought about something else, or trying just something different? Because that helps. That's about the client, and for the client not to be afraid and go, I think we've come as far as we can in our journey, Mary, and I'd like to try something else. Do you know, I'm a supervisor as well, and I also use supervision.
Should we slightly unpack what that is as well, just for people who might not know?
Well, and probably a great question to ask a therapist as well at the start, that all therapists should go to another therapist who's trained as a supervisor, trained in supervision, to unpack anything that they might be carrying, but also to go, I'm stuck with Hannah, that we just don't seem to be moving forward. And there's that insight. Someone else has a different way of looking at it, and go, well, have you thought about this, Mary? And so on. Or even very much looking at ethics. A supervisor will be just checking that the therapist is being ethical. So supervision is really important, and a great question to ask. How often How often do you go to supervision as well and take issues?
And just before we move on to sort of the final thing about how to have the conversation about potentially stopping therapy if you want to, what are your thoughts on the frequency of how often you have therapy? You know, whether you think there is an optimum, whether it's once a week, twice a week, whether it's bi-weekly, which is one of the most annoying words in the world because it has two meanings, but you know, whether you mean twice a week or whether you mean a word that's made for specificity and is not at all specific. It's very annoying. But yeah, you know, some people have it every 2 weeks, some people have it weekly, sometimes people just do a check-in every now and again. What are your thoughts around that?
And all of the above work for the client. Weekly or once a fortnight is absolutely great because you've got that continuity to know that relationship is building. Someone who dips in every 3 months, it's almost like starting that relationship again. You've maybe got a wee bit of work before you can start to go and get into any relational depth as such. So as frequent as the client is able to do, weekly, fortnightly, in my view, is ideal. Some clients, and I do have some clients, depending on what's going on with them, who'll say, can we do this twice a week? I don't know what my resistance is to that. I'll maybe take that to supervision, Hannah. But sometimes, you know, with that, you go, does that feel too much? Do you know, does that allow time for the client to process what we're talking about? If they're there on Monday and they're back on Thursday. And maybe that just go back to my training where it's that we both need processing time, the therapist and the client. So, you know, and maybe weekly allows that. But that's not to say I haven't offered, you know, twice a week to clients based on their need. They're maybe going through a breakup and feeling quite distressed with little support around. And therefore that the therapist is that support, is that sounding board, even if it's just, you know, even if it's listening to someone's anger. Which, you know, which has happened, just someone, ranting, and you go, and that's okay. That's what they need. And if they need to do that more often, then allowing that to be. But being careful that the client isn't rushing themselves. I think that's maybe where my reluctance comes from at times, and going, are they trying to fast track this process and not giving themselves enough time? And I generally would throw it back and go, if that's what you need, you know, have a wee think about it. If that's what you need, I'll absolutely fall in with you. But just have a wee think, what's driving that? What is that about having therapy twice a week? But it also works. I had a client this morning. I hadn't seen her since, the start of the year. And it's wonderful. And she's going, just want to check in, Mary. Just want to see where I am and just throw a few things out there. And that's so healthy. That's almost that maintenance of our well-being, isn't it? And just going, this is where I am. So just, you know, can you spot anything in there, Mary, I should be paying attention to? And that's a wonderful approach as well.
And then I guess to sort of wrap up, what happens? I think a lot of people are a bit scared that they'll almost get stuck in therapy because they don't know how to leave. What are your thoughts around that?
There are two sides to that, Hannah. I do find sometimes there are clients who don't want to leave, who are reluctant to leave because and maybe it goes back to the beginning, because it is so supportive, because they're in an environment where they can just be themselves with absolutely no judgment. And who would want to give that up? That 45 minutes, 50 minutes, 1 hour, whatever the length of the session is, and to be in such a trusting environment. And yet, you know, therapists are probably the only profession who set out to make themselves redundant. And there's a success when you become redundant with a client. So is giving the client the tools and the techniques that they can go forward, and being able to help them take those, the wheels off the bike, those sort of, what are they, stabilizers, whatever, off the bike.
Yeah, let's not take all the wheels off the bike.
No, no, that wouldn't be good. Good point, Hannah. I clearly need to go back to some training. Yes. But there is that. So sometimes with those clients, and you can see the shock on their face when you sort of go, what work have we got left to do now, Hannah, do you think? And they go, are we finishing here, Mary? And sometimes it is, well, let's try go fortnightly. Let's try go 3 weekly and see how that is. And the clients eventually go, hey, really don't need these stabilizers on the bike at all. I'm good. For others, then it's those that, being able for the therapist as well, being able to say, where do you think we are now, Hannah? To be able to notice what's left, what work is left, do you think, for us to do? And you're encouraging the client to recognise they've done all the work that they need to do. And also for the client, as we said earlier, that do they feel stuck? Do they feel that they're going to where they want to be, or there's just something about the relationship that's not working? And hopefully to be able to be honest and just go, I'm thinking a change might be beneficial for me. And a good therapist will absolutely welcome that, Hannah. Hopefully a therapist will see that first before the client has to. Or funny, both at the same time. Again, I think a few weeks ago, and I'd said to a client, more or less along those lines, where do you think we are? Do you think we're coming to an end? And he goes to me, Mary, I was just thinking exactly the same thing.
Aww.
And you go, that is wonderful. We're both, we're both, in the same place. And that's a lovely ending. That was a lovely ending. But that the relationship should be that the client can say what they want to say. Yeah. And go, I'm not getting enough out of this, or this is what I would like in therapy. And together we sort of, we make that happen, or say, or be honest enough to say, I'm not sure I can deliver that, Hannah. Yeah. I wonder if, that you find someone else I might be able to recommend, or you have a look. Right back to your first question. Yeah. You start to look through and go, where can you find someone to meet those needs? Yeah. Because it's so important. Clients who come back, who send feedback in, I've never had anyone come and say to me in all of those years, well, that was rubbish, Mary. That did nothing for me. The clients have come back from that. This has saved my life. To this has really been eye-opening. This has helped me make the changes that I've wanted to do for a long time. Yeah. And if we value ourselves, if there's anything there, it is so worth looking at having therapy. Nothing to be afraid of, and so much to gain for sure, Hannah.
That's amazing. Mary, Burch, thank you so much for joining us and for filling us in on all of that. That's really, really useful.
Thank you, Hannah. And the dog, the dog comes extra. Yes. That's it. Just throws in an odd wee bark. That's it.
Thank you for listening to the ABF podcast. If you've been affected by any of the issues raised in this episode, you can find helpful links in the show notes. If you would like to become a member of the ABF, support us, or require support, you can find everything you need on our website, details of which are also in the show notes. Until next time, goodbye.